Hi guys, this week on Frank Explains. Sorry I missed last week. I had that bit of back and forward with Medicare. This week we are talking about manual versus electric toothbrushes. Very common question. I always got asked, hey, are electric toothbrushes really better? Yes, they really are better. So we have enough evidence to show that. We know that you get, an improvement of decreased plaque and decreased gingivitis with them, though the amount is marginal. Meaning that if you really don't want to use one, you probably don't need to use one. Like you're probably fine. If you go to the dentist, they're pretty happy with how your teeth look. You're not getting new fillings every time. You're not getting, your gums aren't bleeding. If you generally have a good oral environment, you do not need an electric toothbrush. You're fine. I don't actually use one myself. I use a manual. If you are having issues, if your dentist has recommended you one, definitely upgrade. It could be the difference between you having constant problems to you having significantly less problems. With electric toothbrushes at the moment, I am recommending I used to recommend the Philips Sonicare. That's a fantastic toothbrush. If you still have one, keep it. It's still great. I wouldn't upgrade to this one if you have that one. But the one I am recommending now is the Oral-B IO, like 4 or 5 and above. It's got a beautiful light on there, which kind of changes color if you're pushing too hard, which is a very common problem. And the cleaning mechanism, that kind of oscillating feature, is leading in terms of reduction of plaque. With manual toothbrushes, look, there are a couple of key things with manual toothbrushes, and really the main thing is with the bristles, we want really, really soft bristles. So the softer the bristle, the more the other bristles can bend out the way for you to get into the nooks and crannies better, and the less likely you are to scrape your enamel away. The medium and the hard toothbrushes, they definitely feel nicer to brush with. You're kind of like, oh, yeah, that feels great. The problem is that you're probably scraping enamel away, and you're definitely scraping gum away. So please do not use those toothbrushes. You have to kind of be careful of them as well. So if you're brushing and the bristles start to bend, they're not working properly, so chuck it out. And you should really just be changing your toothbrush every 3 to 4 months regardless. They do harbor quite a lot of bacteria inside of them. Even with the electric toothbrush, you've got to change that head. Like I said, I use a manual toothbrush. I think if you've got a decent bacteria control in your mouth, you should be fine. Price difference is huge. You're looking at what, $5-10 for a manual toothbrush. You're looking at $200 for a good electric toothbrush, and then those heads each individual head is more expensive than a whole new manual toothbrush. So it's much easier to travel with everything. So yeah, I like manual toothbrushes. I'm a big manual toothbrush guy, though I do recommend electric toothbrushes from time to time for some of my more problematic patients.